Okay, good morning. Kojo.
Yeah, no.
Yeah, so I won't waste much of your time. We'll go to we have a learning outcome too. Don't worry, if you are busy, I'll turn the video off and then you can just listen, okay?
All right, okay.
So just 1 minute. I just want to
Okay.
so after the introduction, we'll turn the video on for a few minutes and I'll turn it off, okay?
Okay.
So I'll turn my video on. Can you see me?
Yeah, I can see you.
Okay, very good.
Mm.
Very good. So we're having learning outcome two. Okay, we did learning outcome one yesterday, last week. Okay,
Yeah.
so learning outcome two, we're trying to understand the socioeconomic, political, and cultural factors influencing the well-being and health in choosing national contest. It has two folds, 2.1, 2.2, where we are going to analyze the socioeconomic and political cultural factors, and also analyze the government and regulatory responses to those selected contemporary issues. And then lastly, the 2.3, which is the third part, you have to assess the capacity of current health and social care frameworks to do those impact that we have stated. Okay.
Okay.
And that's when you're able to do that, you're able to achieve a merit. But then you can achieve a distinction if you are able to evaluate those impact of government responses to those contemporary issues.
Okay.
All right.
All right.
All right. So you can put your full name on the chat room and then you can turn the video off. Okay.
Okay.
So I'm not going to share the full screen. Let me take it from there.
Yeah, I'm done.
Okay, that's all right. 5 minutes. Can you see the screen, please?
Yes.
What do you see on the screen, please?
Contemporary issue in
That's
health
fine.
and social care.
LO2. So that's fine. So I did mention that we're going to do about LO2. So that's fine. I'm sure it's supposed to be somebody else to join. Or
Yeah, like two people.
but they don't join, isn't it?
Yeah, then yeah. But I've even posted the ID, the course ID on the WhatsApp page, but I don't know why they haven't responded.
Okay. One minute.
Okay.
So obviously we're going to look into social, economic, political, and cultural factors that influences the well-being and health and social care. And when you say the social, when we want to analyze the socio-economic and political and cultural factors, one of those factors we have to look into is the income inequality. We spoke about it the last time, if you remember.
Yeah.
And what do you remember about that? If you remember what we spoke about, Solomon.
Income and inequality, like
Yes. What do you remember?
what I remember, like the income that to come into the health sector, and sorry, okay.
That's fine. So we said when it comes to the well-being and the socio-political framework, inequality in salary does not really affect,
Perfect.
yeah. So it says to examine the distribution of wealth and income in a chosen national context, consider how disparities in income affects to healthcare, tuition, housing, and education. Okay,
Yeah.
we mentioned that due to the huge differences or disparity between salary, there are those who can only access certain amenities, okay?
Yeah.
And there are those who can access more. And we said that, for instance, somebody can go beyond the national health insurance, which is the foundational, and then do private, isn't it? Healthcare.
Yeah.
Yeah, okay, what are they? So if you remember, yes. And then we also spoke about employment conditions,
Unconditional.
where job security, working conditions, explore how unemployment rates, precarious work arrangement, and workplace hazards impact health outcome. And for obviously, for somebody who have a stable job and somebody who is working in an agency, obviously there will be differences, isn't it?
Yeah.
Yeah. So if you don't have unstable work pattern and then unstable job and your rates of pay are not true, obviously it affects the health outcome that comes up may affect you. But somebody who may have some stable job, and may even have other incentives that they get. So the work conditions have socio-economic impact on the citizen or a person, which then affect the national work here. And the person goes to work and is not happy, and therefore he cannot put his full maximum output in the job, isn't it?
Yeah.
Then we can look at educational levels. So we mentioned that, yes, of course, obviously, others may have good rates and all that because of educational level, isn't it?
Yeah.
Yes, and health literacy, because someone paid on the education may able to have health literacy, economic mobility, and adoption of lunch promotion behaviors and all that. So
Yeah.
access to quality education influences health literacy. That's very important. Socioeconomic mobility and adoption of health promotion behaviors. Okay. And then government policies. Government policies. That's 1 minute. Then we have the political factors. What are some of the political factors that you may think of, Ojo?
Yeah, the political factors. One is if the government is not paying this one well, or maybe the workers who is working at the NHS well, it's going to affect the health sector because the workers there are not going to be happy about their salaries and those kind of stuff. So they will not do the work, even the work that they want to, they have to do it good. They will not do it well. Yeah.
Exactly. So exactly what you stated in there. So when there are government policies, that we would not favor, social welfare programs by government, access the funding, resource allocation, regulatory framework to address those health disparities and promote. So we all know that everything is politics, isn't it?
Politics, yeah.
Yeah. So when the government don't have better staffs to address those things, those are the things that. So the policies that are done, the policies, first of all, the policies should be intact. It should be fair in description of those and how to share them. So those are things that we need to look into the government policies and all that. So it says that you should be able to evaluate the healthcare policy, social welfare programs, public health initiatives implemented by the government, assess the adequacy of funding, resource allocation, and mobility frameworks to address health disparities and promote population health. Okay. Very, very, very important. Then we have to look at the political stability. I was expecting for you to state that. When there's no peace in the country, doesn't also affect the people?
Yeah, it's affecting.
So that I was expecting you to say as even the first one. So lack of that is a problem.
Yeah.
It's really a problem, yes. When there's no political stability in the country, it affects governance, it affects leadership, it even affects the healthcare, okay?
Healthcare, yeah.
All right, then we can look at the healthcare system structure itself. The healthcare system structure itself. Why we look at the examination, financing, and governance of the healthcare system, assess the extent of public versus private sector involvement, the role of insurance mechanisms, and accessibility of healthcare services for different populations. So these are things that we can also look into in that regard. Okay. So when we say the healthcare structure system, what do you understand?
The healthcare structure system.
Yeah.
What I understand is if the the healthcare system is not structured well, it's going to affect the health system in the country, especially if they don't have enough facilities to keep a patient. It's going to affect the health system. Hello? Hello? Oh,
Are you there? Hello, Solomon. 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 Solomon.
I know you have people or
Solomon.
friends in high posts.
Solomon. Hello. Hello, Solomon. Solomon, can you hear me?
Hello.
Can you hear me?
Hello.
Can you hear me, please? Solomon. Hello. Can you hear me, Solomon?
Yeah. Now it's coming here.
Okay, that's fine. Just hold on. Just hold on. I don't know what's happening. Just hold on. Can you see the screen now?
Yeah, I can see it.
Okay. Let me on standby. I have to just quickly go back to this internet and research it. So we go to this side, isn't it? Just bear with me.
Health system structured version.
Alright, so we can record.
Hello.
Oh, goodness.
Jojo?
Yeah, hello.
Okay, I'm back. I have to check the internet. What's happening? So let's go to gender.
Okay.
That's what we got, isn't it? Let's crack on.
Yeah.
Are you still the only person? Okay.
Yeah. Yes.
So let's go to gender. That will be the intersectionality and interesting intersecting factors. So let's look at gender dynamics. Okay.
Yeah.
So examine the gender disparities. Obviously, everything about healthcare is concerned about equality, isn't it?
Yeah.
And gender balance. So it is important that, and when we say gender, what's your understanding?
Oh, gender. Gender is like let's say male, female. If the person is male or female, you have to treat them equal.
And then what else?
and gender. One more.
Are you there?
Yeah, I'm here.
Yeah, you have to treat them equal, but equal in what?
Equality in terms of I will use the healthcare as an example. As I'm a carer right now, yeah. Let's say I'm a care home. We have a woman and maybe man and the care home, but the woman, his behavior is not good, but the man behavior is very, very good. It does not matter. I should just say as an equal. I should not say I should not do bias and say let's say the man is very good, so I have to treat him well and leave the woman whose behavior is not very good. Yeah.
Okay. Okay, if you say so. All right. So so let's look at what about the ethnicity and race and race. Ethnicity and race. What's your understanding on that?
Ethnicity and race. In my point of view, I would say ethnicity, like maybe I'm an African and another someone is a British, and if I working within the care sector and as or in healthcare sector, and there is a black, there's an African person there and there's a British person, I have to treat them equal because we are all human beings. Let me say that we are all human beings. I will not say because of I'm an African and this man too is an African, so I should treat him good than the other one. Yeah.
That's very important.
Yeah.
That's very, very important. But then let's look at urban and rural divide. Urban and rural divide.
Okay. The urban and rural divide is going to be like, let's say, this person stay at urban place because of he stay at the urban place. He have money or like he's rich, and the person who stay at the rural place doesn't have money. So I should treat the person who have money good than the person who don't have money. I have to treat them the same thing, like equal here. Yeah.
That's fine. So where gender we're looking at the roles that gender you don't have to victimize, you have to make sure you have equal sharing of roles.
Yeah.
For gender. When ethnicity, we're looking at the ethnic race, you cannot discriminate against the race or the color.
Yeah.
And then when urban rural divide, we're looking at the disparities with health and well-being, isn't it?
Yeah.
Good. So and then the difference between the healthcare infrastructure, environmental exposure, socioeconomic opportunities, and the social service availability. You make sure that within the urban and rural and you don't discriminate. You make sure there's equal fair for the rural area and the urban area. You don't say that the city, because it's a city, so you give them more amenities than the rural areas or the village areas, isn't it?
Yeah.
Good. Let's crack on. What about data and source evidences? When it comes to data and data sources evidence, what you have to utilize the quantitative data from the national surveys, census report, health indicators to quantify the impact of social, economic, political, and cultural factors on health outcomes. Incorporate qualitative data from interviews, focus groups, and ethnographic studies to capture the nuanced experiences and all he's talking about is that whatever data that you gather for You gather for whether it is qualitative survey or you have to make sure that you have equal, okay, again, equalship for the various organizations. So you say the data from the national survey, census reports, health indicators to qualify the impact of socioeconomic, political, and cultural factors on health outcomes. Incorporate those data from interviews, focus groups, and ethnographic studies to capture the nuanced experiences and perspectives of individuals and communities affected by these factors. So it means that you need to be able to have a way of gathering data, okay? So those data, you need to use that to look at the impact. For instance, if you have provided healthcare services for an area for about 2 years, probably the population for that 2 years was very less, okay? And over time, 2 years, 3 or 4 years ago, there have been lots of people who have moved into the city. You should be able to have data, to collect data and know the statistics, that the national statistics for that area probably is about 15,000 as compared to 4 years ago. And that will help you to know the impact, the socio-economic impact that is affecting. For instance, the healthcare social factors are the things that you provide there. Are they meeting up the standards of the people there or not? Okay. Are you there?
Yeah.
Do you understand me? Okay, let's proceed. Let's quickly. Then we have to look into the evaluating the government and regulatory responses to these selected contemporary issues. In assessing government and regulatory responses to selected contemporary issues in health and social care, involves examining the actions, policies, regulations implemented by government bodies. And just 1 minute.
All things vintage and antique. From free post. Helpful guide in your free issue post. Vintage cash cow with 3 food on Shop Planet with over 13,000 reviews. Cash in those up all in one go with vintage cash cow. All today visit cashcow.co.uk.
Okay, so Kojo, are you there with me?
Yeah, I'm here.
Okay, so let's look at identifying those contemporary issues. We need to first of all look into begin by selecting specific health issues. And then look at how we can examine that, reflect those issues that a country may be encountering. So looking at letting the health social care issues that's currently prominent or pressing in your chosen national context. This could be topics such as healthcare access, mental health services, aging population, infectious disease outbreaks, and substance abuse. So it could be any of them. So let's say 1, review of government policies and legislation. Review of government policies and regulation. Examine the policies, laws, and regulations enacted by government to address the selected contemporary issues. Analyze key legislation related to healthcare and social welfare programs, public health interventions, and regulatory oversight. Consider how these policies formulated may impact assess the rocks of government agencies, regulatory policies, regulatory authorities in shaping healthcare policy and practice. Are you there?
Yeah, I'm here.
Okay. Then so obviously we're looking into reviewing government policies and legislation. And in reviewing those policies, we are looking at how we examine the policy, the laws, the regulations by the government to address those selected contemporary issues. And what are those issues? Just mental health issues or substance abuse and all that. Those are the things that we intend to look at. Evaluate
Okay.
funding, okay? So we consider if these policies are formulated. Just for a minute.
Okay.
Good. Then we have access to public health campaigns and initiatives. Consider how these policies are formulated, implemented, and enforced. Assess the roles of government agencies, legislative bodies, and all that. So we need to be assessing all those to ensure that the policies, the legislative and the regulatory framework that have been done, they are able to conform with the issues confronting the country, okay, or the area. Very, very important. And when you're able to review, you have to look at the funding and the resource allocations, okay?
Okay.
You're able to assess government budgets and funding allocations for health and social care programs, analyze trends in public spending on healthcare infrastructure, workforce development, disease prevention and treatment services. Consider whether funding levels are adequate to meet the needs of vulnerable populations, address emerging health threats, and sustain essential healthcare services. Okay, so in the funding part, you should be able to assess the government budgets and funding allocations for health and social care programs and analyze trends in public spending on healthcare infrastructure, development, disease prevention, and all that. And then consider whether the funding levels are adequate to meet the needs of the vulnerable populations and address emerging health threats, sustain healthcare services. So these are very important as well that we need to look into. Then we have to look at the public health campaign initiative. Public health campaigns and initiative. What's your take on that?
I say public health campaign initiative. I would say like making a campaign or making a campaign to make sure that the health system is very good or well structured. Yeah. To so that it will going to help the public as well. Yeah, that's the view. That's my view.
That's a very good point.
Yeah.
That's a very good point. That's a very good point. Okay, so it says evaluate government-led public health campaigns, awareness raising efforts and preventive interventions targeting the selected contemporary issues. Analyze selected contemporary issues. Analyze the scope, messaging, and intention of these campaigns promoting health behaviors and reducing health risk. Consider the use of mass media, digital platforms, community outreach, education programs to disseminate health information and mobilize public support. That's what I mean. Then we can talk about this one.
Still talking.
Then we have to look at the examining regulatory frameworks and quality standards. Okay, so once we've spoken about the access to public health campaigns, where we are looking at more of social media, the use of social media, digital platform, community outreach, education programs to disseminate health information and mobilize public support. We can also look into examining regulatory frameworks and quality standards.
Okay.
Okay,
Okay.
then let's look at the regulatory frameworks and quality standards, where we're analyzing. Are you there? Can you hear me?
Yeah, I can hear you.
Okay, just hold on 1 minute. The framework. Then we have analyzing the regulatory frameworks and quality standards established by government agencies to ensure the safety and efficiency and accessibility of healthcare services. You should be able to assess license requirements, accreditation process, performance metrics for healthcare providers and facilities. Okay.
Okay.
So that the role of regulatory bodies in monitoring compliance, investigating compliance, and so it's all talking about the frameworks that may be in place. You should be able to examine and make sure that you are within the framework and you are complying. Some of them are the CQC, which you know about, isn't it?
Yeah.
And all the quality groups. So you have to make sure the accreditations as a care home or as a company, you should be able to meet those things and ensure that you are always complying relations to that. Then we have exploring inter-sectoral collaboration and policy coordination. Investigating those collaboration between government agencies and non-government agencies and looking at how to analyze those initiatives. Okay, then you have to look into considering how government agencies coordinate efforts across health and health education, housing, employment, and other sectors to address the underlying determinants of health and social care well-being. Those when you do that, you are exploring those intersection between the policy coordination and the government agencies. Okay, so you have to look at government agencies, healthcare providers, community stakeholders to address those complex issues. We have something called the interdisciplinary committee within every council, where when there are issues with the care home, you have safeguarding team person appointed from the council. You may have the police getting involved for one single issue, because if the safeguarding concern is not only the safeguarding team in your company, but you may have the police getting involved. You understand me?
Yeah.
And the social service getting involved for one particular incident. Why? Because it's a safeguarding issue. You understand?
Yeah.
Exactly. So if the minor, depending on the state of the safeguarding issue, so there must be collaboration within those things. Okay.
Okay.
When such things happen, yeah. And then you have evaluate policy impact and outcomes. Assess the impact of government and regulatory responses on health outcomes, equality and access to care. Okay, again, we've spoken about it. So utilize those data on health indicators and performance metrics to measure grades towards policy objectives and targets. Consider the perspectives of stakeholders, including healthcare providers, service users, advocacy groups, policymakers on the effectiveness and equity of government interventions. Identify gaps and areas for improvement. Identify gaps, challenges, barriers in government and regulatory responses to selected contemporary issues in health and social care. Evaluate opportunities for policy innovation, system reform, capacity building to address these challenges effectively. Consider lessons learned from international best practices, evidence-based interventions, and stakeholder engagement process in shaping future policy directions. Again, when you're identifying those gaps and areas of improvement, in other words, you identify the gap challenges, barriers in government regulatory responses to your selected contemporary issues in your health and social care, where we say the contemporary issues could be system abuse, could be mental health issues, could be cultural issues, could be amenity issues, resource-based issues. And so you should be able to evaluate the opportunities for those policy innovations and look at, but does it need any system reforms? Does it require capacity building? When we say capacity building, then we are looking at, does it need some training that need to be given to the citizenry? Or if it's a care home, does the staff need certain trainings to meet the regulatory framework that have been made? If it's CQC, normally if you are in a care home, you remember if the CQC inspection, your managers will be on you to put things right, isn't it?
Yeah.
And meet up those CQC. So these are things that you have to make sure your staffs have the requisite trainings. It could be level 2. You have to make sure they have level 3 qualification, health and social care. They have their DBS up to date and all that. So these are all things that we have to review and look at it. Are there gaps of improvement that needs to be done to meet those practices? Okay.
Yeah.
Best international or local. All right.
Yeah.
Good. Then let's look at analyzing or assessing the capacity of current and social care frameworks to deal with the impact of key contemporary issues. Where we can look into 1 minute, the key just 1 minute. Now, in identifying those key contemporary issues, we must look into the factor that may affect those issues. Now, we've spoken about the review existing framework systems. Existing framework, does it need reviewing? So let's say there's a framework about data protection, but looking at those frameworks, it may need some evaluation, it may need some reviewing.
Mhm.
Okay, so you have to consider the roles and responsibilities of government agencies. And then we also have to look into the access resource allocation. 1 minute.
Okay.
Resource allocation and availability. We should be able to analyze the allocation of resources, including funding, personnel, equipment, infrastructure within the health and social care systems. Assess whether resources are distributed equitably to meet the needs of diverse populations and address priority health issues. Consider the adequacy of funding resources such as government budgets, insurance schemes, and donor support in sustaining essential services and responding to emerging challenges. Okay, so
Okay.
what we seek to do is that we're analyzing that those allocation of resources or funding that is available for a country, are they equally distributed or equitable, what we call equity, to meet those needs of diverse population address and priority issues. Okay.
Okay.
Yeah. So we are all doing is we are trying to assess, and then we have to consider if there's any adequate funding, if there's any adequate funding that may be available. If there's not, sometimes when you have to when you have to so to speak, when you have to look at some support to give service users or patients, they always look at the funding that is available for that patient. Okay.
Okay.
The number of carers that they can assign. Sometimes some people have more funding than the others. Okay.
Yeah.
Exactly. And so these are things that we need to review and see that
Yes.
can the patient have 5 carers call out at his home or not, the kind of funding that is available. So these are things that we need to review every now and then.
Yeah.
Okay.
Okay.
And also have to review preparedness of public health emergencies. Assess the capacity of healthcare system to respond to effectively public health emergencies such as infectious diseases, outbreaks, and natural disaster. Evaluate the availability of emergency responses plan, surveillance systems, and healthcare facilities for managing crisis and protecting public health. Then we have to analyze healthcare workforce capacity. Evaluate the availability, distribution, and skill metrics of healthcare professionals within the workforce. Assess workforce shortages, retention challenges, disparities in access to healthcare providers, particularly in underserved areas or for specialized services. Consider strategies for workforce development, including recruitment training, task shifting, and retention incentives. Okay, so we have to be able to look at the healthcare workforce capacity. And in doing that, we have to look at the healthcare professionals themselves within the workforce to assess the workforce shortages. Like today, you spoke about your company is short of staff, isn't it?
Yeah.
Exactly. We need to analyze. So it could be a whole nation that may be short of nurses and carers. Hence why the skilled visas came in, isn't it?
Yes.
Because they realized that during the COVID-19, a lot of people died.
Yeah.
A lot of nurses died, and so many jobs they don't have people to fill in the gap. Hence why they opened the door for skilled workers to come from abroad to help them. So these are things that a country need to analyze. Okay, you
Yeah.
need to analyze to fill out some of these shortfalls, so you can come out with strategies or things that you can use or strategies to deal with some of these things where there needs training and all that. You look at it as well. You're a skilled worker, isn't it?
Yeah, muscular.
And then we have to look into access integration of health and social care services. Again, the health and social care services for a country involves a lot of for children, um, for even adults who need issues with their social care interventions. And also that you need to also evaluate them to see that we have enough social workers, community organizations, stakeholders to look at patient-centered care, where things are centered around the patient. We have to consider the availability of support care such as home care, rehabilitation, palliative care, social assistance to address this complex needs of vulnerable population. We also have to consider technological and ethical solutions. Explore the adoption of technological and digital solutions to enhance health and social care delivery. Assess the use of electronic health records, telemedicine, mobile health applications, and remote monitoring tools to improve access, efficiency, and quality of care. Consider digital literacy, privacy concerns, and disparities in access to technological as factors influencing the effectiveness and equity of digital health solutions. So these are things that we have to look into. We have to also have to look into to engage stakeholders and community partners. In so doing, we are involving stakeholders, including service users, advocacy groups, healthcare providers, policymakers, community organizations to look into the assessment process. We have to then seek the perspective and insights of those recommendations that comes with the frameworks to address contemporary issues. Then we have to also look into fostering collaboration and partnership. So to participate in this planning and also in the evaluation of the healthcare intervention. Okay. Very important. Partnership is very, very important. Okay. Even in the workplace,
Yeah.
You always have to partner, isn't it?
Yeah.
You have to do handover. It's all part of partnership.
Partnership, yeah.
And then we spoke about the gaps and areas improvements. We have done that as well. And then we have to look at to evaluate the impact of government responses to contemporary issues. One of this is define metrics and objectives. Okay, where your objective you have to clearly define the desired outcome, what you seek to achieve,
Yeah.
and objectives of government responses to contemporary issues. Identify specific metrics and indicators for measuring your success as changes in health outcomes, success to care, equity to service delivery, and cost effectiveness of in the intervention. Very important. Now, qualitative analysis. Qualitative analysis. Utilize qualitative data sources. When we say qualitative, it's about quantify, okay?
Yeah.
So using data that could be questionnaires, survey, campaigns, administrative records, okay?
Yeah.
To analyze trends over time and across different population groups to identify changes in key outcome measures. Conduct statistical analysis such as regression modeling, difference in differences analysis, or interrupted time series analysis to evaluate the association between government interventions and health outcomes, adjusting for confounding factors. Okay, so in other words, you're all trying to gather data, and those data can be done through questionnaires or surveys. That would help you to look at the impact government responses you are getting from the government. Also to analyze the trends over time and across different population groups to identify changes in key outcome measures. So the metrics is that the metrics you are using is a qualitative analysis, okay?
Okay.
Where you are using data to gather information, isn't it?
Yeah.
In the workplace, you can say feedback, isn't it?
Feedback, yeah.
Get feedback from the clients. Do you work in a care home?
No, I don't.
Supported living.
Okay. Yeah. I do live in care and dom
Okay.
and domiciliary.
And domicile. So yes, you normally dom care, you go to various homes, isn't it?
Yeah, sure.
So their parents, they may have next of kin, isn't it?
Yeah.
So feedbacks
from,
helps in achieving some of these things.
yeah.
Then qualitative. Qualitative is that you are using interviews, focus groups, case studies, policy document analysis to gain insights into experiences and perspective and narrative of stakeholders affected by the law government policies. Explore how generated policies perceived, interpreted would help. So where you have done qualitative, quantitative, you see data sources, including epidemiological surveys, health registries, administrative records, economic indicators to assess the impact of government responses. Conduct statistical analysis such as regression modeling, difference in different statistics, interrupted time. So these are the qualitative ones. But then in qualitative, we are looking at more of quality, okay?
Quality, yeah.
So we are looking at more of case studies, policy document analysis to get insights into that. Explore how government policies are perceived, interpreted, and experienced by diverse communities, including service users, and healthcare providers. All right. So
All right.
those things are so police. So when you're achieving that, you have to look at some of the government policies and all that. Okay.
Okay.
Yes. And just 1 minute. Oops. And then we look at comparative analysis. In comparative analysis, you are more used to going to draw one minute. Then compare the impact of government responses across different regions, countries, to identify various outcomes, implementation strategies, benchmark government interventions against international best practices, and evidence-based guidance or standards of call to assess this relative success and identify the areas of improvement. So in comparative analysis, what you seek to do is that you are comparing the impact of government responses across different regions, countries, okay?
Okay.
You are comparing the regions, continents, either the populations, okay,
Yeah.
to identify. So in comparative analysis, normally in project work, or you may have, maybe you may look at the age group, okay, maybe
Yeah.
from 9 years to 11 years,
WSA.
or you may look like even the ethnicity, okay,
Yeah.
maybe say you want to see the number of black people in Manchester or in UK or somewhere, okay.
Yeah.
So you can choose the age, the population, and then you look at the number of support that is given. Are they benefiting from it? Okay, that's where. So you are comparing comparative analysis.
Yeah.
Age 11 year between maybe white people and black people. Okay,
Yeah.
how many black people are going to universities? Exactly. And you can see that in this year, you have more black people going to universities or less people going to universities. Okay,
Yeah.
exactly. Those are comparative. Then we have health equity. Health equity. 1 minute. Just 1 minute. Then we have health equity assessment. What do you understand by that? Hello?
Yeah. To let's say to assess health equity assessment to assess that either the healthcare this thing is reducing or it is rising or increasing. Like maybe like there's a staff in like London who are working as a healthcare assistant. We have to assess and see whether the staff is reducing or it is increasing.
Okay, that's good. That's good. So it's a very good point. And what about the cost-effective analysis?
Cost benefit analysis. This one, let's see. Like the cost that is going to yes, for this one. Let's say the cost that is going to help the health system to improve.
So in cost, we do this just to make sure that we have economies of scale. So in cost benefit analysis, we do that so we can estimate the cost of associated with implementing intervention. So you see, it's just like they say in Bible says that you cannot build a house without not first counting the cost of your foundation, isn't it?
Mm.
Hello?
Yeah.
You can't build a house without not counting the cost of the foundation, isn't it?
Yeah. Yes. Yeah.
So cost benefit analysis, you are just making sure that the cost that you need to do implementing something, you have done the checks and make sure that there's a benefit, okay?
Yeah.
You don't lose, okay? So you do it's like a pre-check, okay?
Yeah.
Yes, to estimate the cost associated with implementing intervention, as well as the potential savings or benefits in terms of improved health outcomes for that gens and benchmark system efficiency. So we are looking at economic to assess the financial implications, okay? Making sure that, okay?
Okay.
Do you understand what I'm saying?
Yes.
Yeah, that's what we call. Okay, so let's. Okay. So you understand?
Yeah, I understand. Yes.
Aha. Then let's stakeholder engagement. Stakeholder. We all know stakeholder. I was thinking about that. The feedback. Okay. Who are your stakeholders in your dorm care? Who are your stakeholders?
My stakeholder, my clients or the
Exactly.
the family of my client or the
Exactly. So they are your stakeholders.
person.
They are your stakeholders.
Mm.
So stakeholders, your clients are your stakeholders. Who are your okay?
Yeah.
Who are your shareholders?
Shareholders. I would say my agency or my colleagues.
Yeah. So the shareholders are the agency, the directors, okay?
Yeah.
But your stakeholders are not only your clients,
Yeah.
even your colleagues,
Yeah.
they are stakeholders, your managers, okay?
Yeah.
They are stakeholders, even external bodies like social workers and all that, they are stakeholders, okay?
Okay.
And it's important you get feedbacks from them, isn't it?
Them, yeah.
The families, even our stakeholders,
Yeah.
the families of the clients, they are
Of the
stakeholders.
clients. Yeah.
So it's important you get feedbacks from them, and that helps you in building that. Policy learning and adaptation. Okay. So foster a culture of policy learning, evaluation, and adaptation within government agencies. Use evaluation findings to inform evidence-based decision-making, policy reform, and program refinement. Identifying lessons learned from both successful and unsuccessful government responses and apply these insights to improve future interventions, enhance accountability, and promote continuous quality improvement. Very, very important. Okay.
Okay.
Yes. So policy learning. So you learn along the line, but you need to have an evaluation finding to inform evidence-based decision making. And when you have done research, you have evidence apart from your feedback. You say, once you get feedback, what do you do? Don't you implement it?
Yeah. Yeah.
You get a feedback, then you implement because now you have evidence, isn't it?
Yes.
Then you can now implement it. Make sure that you are adapting to what's called adaptation. You are adapting to the feedback that you are about to get. Exactly. Okay.
Okay.
And then we are done. And these are the reference you can get there from your models and all that.
Okay.
Okay.
All right. Okay.
Any other question?
No, not really.
Okay, I'll call you on your phone when I'm done. Okay, you have any question you can put on the list. Okay.
Awesome. Okay.
Just
All right.
one. Yeah, I'll call you. Right. Bye.
Bye.